Hello, welcome to Peninsula Healthy Living. The charity was established in 2002 and operates services, programmes and activities across the rural Ards Peninsula. It's a very beautiful part of the country, but like every rural community, access to services is always an issue. Peninsula Healthy Living believes that improving health is about helping people to make informed choices. It is about tackling the root cause of poor health and challenging inequalities. All of our activities have been developed to meet an identified need. So are you ready to take a closer look at what we do? This morning our gym has a range of members and HealthWise clients. HealthWise is a GP exercise referral scheme that encourages exercise as part of the person's healthcare plan. This facility was opened in November 2008 thanks to an investment from the Big Lottery Fund and a capital grant from the Rural Development Council. The gym operates as a social enterprise and generates revenue through its members' fees. Our oldest member is Joan, who is in her late 80s. The benefits of exercise is already widely known. That's why the GPs refer people to us with the worst health. Not only is it improving their physical health, but their mental and emotional health is much better too. Another important factor is the fact that to avail of the nearest leisure centre, you may have to travel up to 40 miles return. Poor access to services is a huge barrier to good health on the peninsula. Peninsula Healthy Living also runs an e-cafe under its social economy sector company. This was also opened in November 2008 thanks to Awards for All and the Rural Development Council. It's for the community and by the community. This project was actually set up to complement another project that is delivered in partnership with volunteers from the community, such as the police, the Forum for Action on Substance Abuse, the YMCA, the Council, the local health trust and ourselves. This is a young person's project called Energy. But this only operates at the weekends, so the building had to be used throughout the week. Hence our state-of-the-art computers and cafe to provide healthy but affordable home-cooked food and to offer a state-of-the-art training facility within the community. Up to 60 young people per night enjoy the safety of the Energy Project. It welcomes 11 to 18-year-olds. In a warm, welcoming environment, they are nurtured and supported to build positive, healthy relationships with not only other young people from different schools, colleges and communities, but agencies such as the police, the Forum for Action on Substance Abuse and the Health Trust. This project is temporarily suspended as we have run out of funds to keep it going. It has a lot of opportunity to challenge the behaviours of young people and to help them to work towards cohesion, sharing and integration. There are about 20,000 residents in the area we work across, with an almost equal split between males and females. Catholics represent about 25% of the population, with the largest groupings being in Portferry and Kirkcoven wards. The peninsula has a small but growing ethnic community. Population projections forecast the Ards area to have a reduction of children and young people under 16 by about 17% and an increase in the elderly by 16%, but the biggest change is expected in the 75 years and over category, who are expected to rise by over 40%. So basically we are anticipating a steep rise in the number of older people living in our community over the next 5 years. Bringing people together from across the community is one of our strengths. We don't have an actual centre. Most of our activities are out in the heart of the community. We bring services to the people using every available space. Peninsula Healthy Living is probably best known for its services outside of Kirkcoven. Church halls, GAA clubs, orange halls, schools, community centres, anywhere that there is space really, we use it. you can see some of the different types of physical activity that we deliver on an outreach basis. Of course, to do this extensive programme we need lots of qualified instructors. Yes, you've guessed it, we trained up local people and supported them through their training. Now they are paid by us to deliver the classes in their own community. We all know the importance of developing good habits in the early years. These children are enjoying a range of fresh fruit for break. This project was supported financially by Peninsula Healthy Living for 3 years thanks to a big lottery grant. The result? 10 local primary schools that took part in the pilot have continued to sustain the Healthy Break initiative. Play is extremely important to the development of a child. It helps them with social, personal, intellectual, creative and emotional development. These children benefit from a structured play programme out of school hours. But it is not just the children who benefit. The project is designed to support parents and carers so that they can work. But after school's childcare in a rural area is useless without a transport system to pick the children up from school. Peninsula Healthy Living's first health project was to set up a community transport scheme. We continue to work with a range of transport operators to meet the complex needs of our rural after-schools programme. The after-schools programme was developed to meet an identified need. It was brought to us by the Early Years Partnership. Peninsula Healthy Living ran a summer scheme from this location over July and 62 children enrolled. The most recent project that we have supported, and one of the most fun, is QNFM. This pilot brought QNFM to the air for the very first time for 2 weeks in August. On the back of an idea from 2 local residents to test a community radio station, we saw it as a great opportunity to get health messages out to the most vulnerable, the sick, the isolated, the lonely. Everyone has a radio. We joined forces with the local community and Queen's University through a programme called O4O, which is aimed at people over 55, and the result was amazing. We now have a QNFM committee, and Peninsula Healthy Living is working with the committee to help them to repeat the station next year, with a longer term view to sustain it on a 5-year licence. Every day there was an hourly slot that focused on the wider determinants of health, so information on housing, finances, education, access to services and a wide range of other issues were aired every day. In the evening and early again in the morning, we interviewed older people to capture their memories. This reminiscence slot made a lot of older people feel valued again. Priceless. Earlier I mentioned the importance of transport. Basically, we discovered very early on in our consultations with local people that unless you improved transport in a rural community, that nothing else would really be improved. Some people may still have to travel about 5 miles or more to reach their nearest village. Here you can see one of the Peninsula Community Transport fleet of vehicles. We at Peninsula Healthy Living are very proud to state that we set up this company. As with a lot of our work, we train up local people and build the skills and capacity of those in the community to take over the mantle. Not only has Peninsula Community Transport gone from strength to strength, it has recently merged with 2 other similar schemes to cover a much wider area. We continue to work closely with them and they support much of our travel needs on the peninsula.